If you're in your 40s and 50s and you're dealing with knee pain due to osteoarthritis, or you've been told that you have bone on bone in your knees, you're probably thinking one of two things. Either I have to give up my active lifestyle of weightlifting, running, hiking, or the things that you love, or this is my new normal and it's just a part of aging. I'm broken at this point. I'm Ryan, the knee pain doc and physical therapist here at Precision Fitness Physical Therapy, and I'm here to tell you that those thoughts couldn't be more wrong. Although knee pain can be normal with arthritis, there are plenty of people out there with severe arthritis that don't have any knee pain at all and continue to participate in the activities that they love. Arthritis does not mean that you have to give up your active lifestyle. Today, I'm going to teach you what arthritis is, some tests and things that you can do to see where you are at along that spectrum, and some immediate follow-up exercises that you can do to start improving your range of motion and alleviating that pain. And then we'll make a part 2 series on how you can start strengthening and restoring your active lifestyle to get past the discomfort that you are feeling. First, let's talk about what osteoarthritis is. Most people just get told by their doctor that it's bone on bone or wear and tear of the joint, and that they're going to need a knee replacement, and that's it. While yes, arthritis is graded based on the level of decrease in joint space in the joint or decrease in amount of cartilage that is there or wearing of that cartilage, it's also based on things like are bone spurs present and are there other symptoms present throughout the joint itself. However, like we mentioned before, there are plenty of people that are in the grade 4 or highest severity bone on bone category that don't have pain and continue to exercise and train through that osteoarthritis. So why is that? Unfortunately, when you stop exercising and you have arthritis, especially if you're lost to some range of motion, you're starting to become less active, you're not putting as much weight on that knee or you're compensating, the muscles around that knee joint start to get weak as well. When that happens over time, as you are stepping, walking, going up and down stairs or squatting to the floor, there's more pressure that goes through that joint itself because the muscles aren't as strong and can't help assist as much. So there's this negative feedback loop of not exercising, creating more weakness, and more weakness leading to more joint pain. Usually that joint pain is due to lack of mobility in the joint and weakness versus just arthritis itself. Now, the other component a lot of people don't talk about is that arthritis is also a complex multifactorial issue and disease. It is very much affected by other things in your body, such as inflammation. So for example, if someone has diabetes or heart disease or a combination of both, that can create a lot of global inflammation in their body. And then if they also have arthritis in their knee and they're walking and moving around a little bit more than usual, that can pop up as knee pain, and it gets triggered much easier because that baseline level of irritation and inflammation in their body is already higher. Now, if you're someone that is generally really healthy, you're not dealing with a lot of those other things, sometimes there can be even a little bit of elevated baseline inflammation based on if you're not recovering or sleeping well, if you're not eating the greatest, especially consistently over time, and if you are training too hard or have too much volume going on. So it doesn't necessarily mean that you're only going to have pain with arthritis if you are unhealthy and you have some of those comorbidities. It does also mean that there are physical factors such as the amount of training that you're doing, how much range of motion, and how much strength that you have. So arthritis is not a matter of if you train, it's how you train. If you are not exercising and you have knee arthritis, you ultimately will likely have knee pain. If you are over exercising, certainly you can get some increased pain, but what the research actually shows, and we're about to go over, is that exercise helps with pain. So let's dive into the research. Most people believe that exercise worsens knee pain and knee arthritis, and that is actually false. Systematic reviews have showed that consistent exercise improves physical function, quality of life, and reduces pain in people that have knee arthritis. Exercise can help reduce inflammation in the joint, be protective of cartilage degeneration, and improve overall function of an individual that is doing it with knee arthritis. And it is an excellent thing to incorporate into your weekly routine to assure that you are not only restoring function, but reducing risk of further decline due to this. A lot of people also believe that running is an issue that can cause more knee pain or more arthritis or increase your risk for it, and that is also false. There have been studies that show recreational runners have a 3.5% chance of developing arthritis versus sedentary individuals is over 10%. So it's almost 3 times the amount of likelihood of developing arthritis from being sedentary compared to recreational running. Why is that? That can be confusing to a lot of people because they oftentimes have pain when they tried to run or when they tried to exercise. And the reason behind that is because your body reacts to the forces that you put on it. Yes, if you're currently in a state of inflammation and pain and you try to go do those things, it's not going to be great. It's going to increase your pain and you're going to struggle to kind of get back down to baseline. However, if you're not currently having pain or you find help to get that pain level down and you're able to then consistently either run and or strength train, you should absolutely be doing the strength training component. The joint will actually react to the forces that are being put on it during that running and during that training and help rebuild the bone around it and improve your bone density and improve the strength of the cartilage in that joint as well. In addition to when you are strength training, improving the muscle strength and the volume of the muscles around the joint so that they can absorb more load of the impact of the forces of gravity when you're stepping and when you are running. If a healthcare provider like your doctor, physical therapist, chiropractor tell you that you need to just stop exercising, stop running, or stop weightlifting because of your knee arthritis, they're giving you outdated advice. In some rare cases, if you are far enough along and you've tried everything, in that case that may be correct, or for certain periods of time while your pain levels are coming down, that may be correct. But for most people, you are able to get back to that level of being able to consistently exercise. It just has to be the appropriate type for you. So next, we're going to go through a few tests that you can quiz yourself and go through to see where you are at in the level of severity of your symptoms. Now, if any of these are causing you pain, you should not attempt them or push through them, and you should seek advice from a medical provider. However, if you're able to do these are quick, easy self-assessment questions and tests that you can do to see where you are at. Number one is rate on a scale of 0 to 10 how much pain you are having throughout the day on average in your knee. If it is somewhere in the 0 to 3 range, the symptoms might be a little bit more mild. If it's somewhere in the 4 to 6 range, the symptoms are moderate, especially if they are coming down and then only going up to that level. But if they're in that 7+ range, they're probably a little bit more severe. None of this is official grading, but it's more based on clinical evidence of what you are dealing with. Next, we're going to talk about morning stiffness. Morning stiffness is one of the most common and hallmark complaints of osteoarthritis. So if you're waking up and your knee is stiff for just 0 to 15 minutes, it kind of goes away after taking your first couple steps. That's a little bit more mild, probably not as much inflammation or irritation going on. If you are waking up and you have stiffness for 15 to 30 minutes, that's probably a little bit more moderate. And if it's over 30 minutes to hours, that's probably a little bit more severe level of inflammation and stiffness that you are dealing with. Are you able to do a full squat to at least parallel depth without any knee pain? Or are you able to get there, but you're maybe offloading that knee a little bit? It's a little crunchy or painful, but you're able to do it. Or do you have severe pain when you even attempt and you can't even get into a squat? Those are kind of those mild, moderate to severe of those squat categories. Are you able to go downstairs one after the other without any pain and just a little achiness? Or are you stepping down with a moderate amount of pain, having to use a railing? Or do you have to avoid using that knee because it is so painful and you can't bend on it as you go down the steps? So after asking yourself those questions, going through those tests, if you're in the mild to moderate category, going through the next series of tests and exercises can be very helpful to restore range of motion. But if you're in that severe category, you probably shouldn't attempt any of these exercises and you should definitely be seeking help from a medical provider. Go ahead and look at these next steps and see where you're at. So one of the most important things is to be able to fully straighten your knee when it is behind you when you're walking. What you'll often find with people that are lacking mobility and arthritis, as they go to push their knee off, it is not fully straight. So go ahead and give these tests a try and the follow-up exercises if that is the case for you. If you are not fully straightening that joint, you're not fully using your quadriceps muscle, which is going to weaken over time, and there's going to be more pressure and wear and tear on that joint over time. Have your knee flat on the ground like this. You're going to think about trying to push the back of your knee into the ground. Can you lift your heel up so that there's space under that heel while keeping the back of your knee towards the ground? You can also try to get your heel, your butt, and your back against the wall and see, can you touch your calf to the back of the wall here? If you can touch the back of your knee, great, but at the very least, you should be able to touch your calf to the wall as you straighten that knee. If you are unable to straighten that knee fully, you want to rest your foot up into this position, and the further your foot is away towards the edge of the chair, the more of a stretch you're going to feel with this. So our goal here is to get a stretch in the back of the knee if you weren't able to fully straighten that knee. You want to hang in this position for about 10, even up to 30 minutes, and your goal is a total of 60 minutes throughout the day until that knee is able to fully straighten and you can actually do that test that we just did. If you're not feeling much of a stretch here, you can also place like an ankle weight or something small on here that's just a few pounds to add a little bit of pressure. Note, you don't want your foot rolling out to the edge, so you want to keep your foot straight up. All right, so once you have tested your ability to straighten your knee and you've started working on stretching it like we just went over, the next thing that you want to do is actively contract this muscle to go ahead and straighten your knee into a band. If you're able to fully get that knee straight by tightening your quadricep muscle, think about pulling your kneecap towards your hip and tightening as hard as you can and holding it there. You should feel this active in the front of your quadricep muscle here and a little bit of stretch in the back of your knee. After 10 seconds, you're going to release it and then go ahead and do that again. The other most important part is the ability to fully bend your knee, whether that be getting down into a deep squat, kneeling down onto the ground, and being able to get back into this position, or at least into this position, is really important for getting on and off the floor, exercising, squatting, and doing everyday tasks. So go ahead and try this next test and follow-up exercise if you are struggling with those two movements. If you're having pain in the front or back of your knee during squatting, you're going to want to try this test. Are you able to fully sit heel towards your butt and not have pain in that knee, or are you kind of shifting away and not wanting to bend, or is there a gap back here? Take a towel and put it behind your knee here, sitting back until you feel a nice stretch in the front, back, and side of that knee, trying to keep your heel towards your butt on that side. And you're going to hold it for about 30 seconds. Do 3 or 4 rounds of this. If there was still pain after doing this towel stretch, give this next assessment a try. And you're just going to see how far you can turn your feet in while keeping your toes on the ground. You'll see is I can turn my right foot over here a little bit further, less internal rotation of this shin or tibia. If I had difficulty bending that knee during that kneeling test that we just did, or rotating my shin inward, I'm going to take my thumb and hook it behind the back of my knee here and interlock my fingers, trying to not let my heel come up off the ground. So I'm really trying to rotate my shin forward and inward as far as possible, but I'm keeping my knee straight in line with my toe. So I don't want my knee coming in like this. I'm pushing it as far forward this way while getting some torque on that shin, going in and out of this position about 15 times. What we're trying to do here is allow improved rotation of this tibia so it can bend further and not get any pinching in the back or front of the knee, and help reduce that pain. You can test your ability to kneel again afterwards, or even get into a deep squat and see if you're able to do that without having that knee pain. When you're dealing with knee pain and you're lacking that full extension, oftentimes you're also missing mobility in your ankle of your toes to be able to come up into this direction, or more importantly, your knees to be able to go over your toes as you're going down a step or into a squat position. If you are missing that range of motion in your ankle, oftentimes what will happen as you go down, either down a step or into a lunge or a squat, you're going to run out of room in the ankle, and then the knee is going to get cave in and get pushed inward a little bit, which can either put more pressure on the outside of the joint as it comes together, or it can overstretch some of the tendons and structures on the inside of the joint and cause pain in either location. Or what will happen is as you squat, your foot will tend to go out like this, and that's also putting more strain in both of those areas. So if either of those things happen, you go to squat, your heels come up off of the ground, or you go to squat, your toes come out to the side, go ahead and try these tests out and then do the follow-up exercises to improve the mobility. For this knee to wall test, I want to see how far I can get my toe away from the wall while still touching my knee to it. So eventually my heel is going to pop up off the ground. So right about there, my heel starts lifting. So I know that is past my limit. I'm going to scoot forward, and that is the sweet spot. So My heel is not off the ground. That's as far as I can get away from me. It's right at the end of this tape. I'm gonna mark a line on there. And you wanna make sure as you're doing this, your toes aren't going out to the side. Notice how I can probably get another inch past there if my toes go out to the side. So you want your toes to be perpendicular to the wall as you do this test. We're gonna measure this distance from that line all the way to the wall. A normal amount of mobility of distance from that foot away from the wall measuring at the toe is 10 to 12 centimeters. So if you are not that far away, or there's a big difference side to side, you should measure and look at both of those. Then you're gonna wanna try this next exercise. What you wanna do is get a band tied around something that's not gonna move and get it low down so it's below your ankle bone on the front of your ankle here. You need to make sure your foot is pointed straight forward and not drifting out to the side. And then what I'm gonna do is have that ankle in the back, my other ankle in the front, and I'm gonna sit towards my heel, get my knee as far over my toes as I can until I feel a nice stretch in the front of that ankle. I'm gonna pulse in and out of that position. Notice how I'm not really standing up and down. I'm pulsing back and forth. So my heel is not coming up off the ground, but my ankle is going forward. My knee is going as far over my toes as I can. And every time I get to the end of that pulse, I feel a nice strong stretch in the front of the ankle here. If you feel a little bit in the back, that's okay too. The last simple strengthening exercise that you can do is to go ahead and do a glute bridge, trying to get up as high as you can. This really helps activate the hamstring and glute muscles and typically does not put a lot of strain on that knee. If you're feeling really good with it and you're not having any pain after going through multiple rounds of this, you can try to lift up the non-painful leg and try to keep as straight as possible in your hips here and then lower back down in order to start building a little bit more strength in that leg. Now, if you were someone in that really mild category where you weren't having too much pain throughout the day, you don't have so much morning stiffness that it's affecting you for more than 10-15 minutes, and you're able to squat, lunge, and do all those stair tests that we did before, these exercises are likely going to be too easy for you. Now, if you are missing any of the range of motion, you do need to work on that before really progressing onto higher level strengthening exercises. But if some of these basic quad activation and glute activation exercises are too simple, you're going to want to tune into part 2 of this video where we start to dive into a little bit higher level strengthening exercises that you can do once you are out of pain. These exercises today are merely meant for improving your range of motion and just starting activating the muscles to help control the pain and inflammation a little bit better so that you can start the strengthening process in the future. All right, so quick recap. You are not broken if you are dealing with osteoarthritis, and research shows that strength training helps osteoarthritis a lot and it does not hurt it. So make sure that you are consistently doing some sort of strength training if you're able to tolerate it. If not, go through these exercises to get started with it. So what is most important? Doing daily mobility exercises such as the ones in these videos prior, as well as potential hip and ankle mobility to improve the areas above and below. If you are looking for more exercises on that, go ahead and download our free ebook in the comments section. 2 would be consistent strength training 2 to 4 times a week is the ideal frequency. If you are just starting out, starting with 2 times a week is acceptable. And if you're a little bit higher level, up to 4 times a week is great. You need to make sure that you are getting rest and recovery days along the way and that you are not pushing through pain. So starting with some of the strength exercises today is really just to kind of get you moving if you're not used to that, or if you are having a little bit of pain. Part 2 of this video, which will be coming out next, is going to be focusing on higher level strength training and the next steps, going from kind of the immediate next step up from this all the way up to more advanced things that you can do to really start combating further progression of that knee arthritis. If you're someone that's looking for more individualized help, I want you to go ahead and click the link in the description of the video to apply for a free discovery call to see if a personalized plan is something that would be more helpful for you. Go ahead and subscribe to our channel for more helpful tips, tricks, and things to deal with the knee pain that you might be going through.